Hi, and thank you so much for popping by. My name is Bita Pobaluzwi. Feel free to call me Bui. Another aspect that I noted here has to do with the First Lady, the beautiful First Lady of Botswana, Kaone Boko. Kaone Boko is a lawyer by profession, so she also comes from the legal fraternity as per her husband, and it will be interesting to see the role that she will play in the administration, whether she will be designated an official role or is it going to be a ceremonial role. But it will be interesting to see how she fits into this current administration, as we saw with the former First Lady, who was highly involved with HIV related work, who was highly involved with adolescent girls and young women. It will be interesting to see how the First Lady Kaone Boko's own personal interests, her professional expertise will be used in the current administration. So, in context to public health, um, the former president, the third president of Botswana, His Excellency Dr. Festus Hontemanyi Mogae, played a pivotal role in the response to the HIV crisis in Botswana. He put in very key and strategic efforts to ensure that the nation was given relief from the crisis. HIV was a major crisis, although it's ongoing. He definitely put some measures in place that were able to curb the rising infection and prevalence rates. Not to say the problem is not there, the problem is still there. Botswana is still considered to be in the top 4 countries when it comes to HIV prevalence and infection rates. And what I think is also key for the public health efforts for Botswana is the rising cases of non-communicable diseases. In fact, that is why NACA, the formerly known as the National AIDS Coordinating Agency, changed its name to NAPA to accommodate health conditions beyond just the focus on HIV. Rising cases in diabetes, high blood pressure. Botswana was classified from low income to middle income country, right? So that transition definitely came with a dietary cost where people are now not as active as they used to be. But people are no longer almost people are no longer spending their time in the fields, or at the cattle post. People are behind their laptops working in the towns and cities. So the transition from low income to middle income has definitely come at a dietary cost. Fourth president, Lieutenant General Ian Khama, was a military man, and as such, his presidency was colored with a lot of activity. He was always at the forefront of fitness initiatives. He encouraged a lot of fitness initiatives in the community. I do remember seeing him doing a lot of fitness activities on television, running, going up these hills, and yeah, and of course, being a military man, that came naturally to him. But what I'm saying is that there is an opportunity for the current president, as previous administrations have done, to take on a leadership position when it comes to a health cause, right? And in this case, I know from statistics and data that non-communicable diseases are a problem in Botswana. All right, my friend, I hope you're having a lovely day where you are. But most importantly, I hope you're having a healthy day wherever you're watching me from.